Hello everyone, it's my pleasure to welcome you to my Home Doctor YouTube channel. Please, if you are just joining us for the first time, kindly subscribe to my YouTube channel. Click on the subscribe button and the notification bell so that whenever a content is posted, you will receive a notification. Okay, I'm Patrick Onyedikachi, your Home Doctor. Okay, today I'm going to be talking about genotype. All those questions that have been bothering you about genotype. How do I know my genotype? How do I make a right choice? Does genotype change? Why do I get two different results from two different labs? These are the things I'm here to clarify you today. Genotype simply means the genetic makeup of an individual, and genotype forms the genetic constituency of cells in an individual. Genotype is made up of two alleles. Allele simply means the observable character in an individual. These observable characters these are the things we inherit from our parents. You pick one from your mother, and one from your mother, and one from your father. You pick the one that is recessive, a material that is recessive from your mother. Either you pick the S or the A, depending on your mother's genotype, and you pick from your father also, depending on your father's genotype and the kind of material, that's the one that is recessive in your father. And genotype is a test or a system used to dictate the type of hemoglobin located in an individual. We all know that hemoglobin is the red pigment in the red blood cells, which help to carry oxygen in the body. These red pigments bind to oxygen molecules in the body. Genotype is classified into 5: the AA genotype, the AS, the SS, AC, and SC. If someone is AA, the person is safe, the person is not a sickle cell carrier, and the person doesn't have trait at all, no trait of sickle cell. But if someone is AS, it simply means that the S there means that the person has trait of sickle cell, but not a carrier of sickle cell. If someone is SS, this means that the person is a carrier of sickle cell. If someone is SS, the person is a carrier of sickle cell. That means the person is already suffering from sickle cell. AC and SC, this is another version of AS and SS. Is similar to AS and SA. Is another version of AS and SS. So if someone is AS or AC or SS, it's just that the person is limited to in making choice of partner. The person is a kind of limited in making choice of partner in relationship when it comes to marriage. Okay. What happens in sickle cell is that in normal individual someone who is not a carrier, the red blood cells, they last for about 120 days in the body before they die. But in sickle cell, they do not last like that. They die before the duration because of the shape. In normal individual, the blood shape is a kind of biconcave in nature. They swim better in the artery. They can move, no matter how narrow the artery is, they can penetrate, they can swim and pass through the artery and get to their destination. But in sickle cell, due to the nature of the red blood cell, it's a kind of circular. I will show you a picture of it on the screen. It's a kind of circular, so it doesn't swim better in the artery. Most of the time, when the artery is a kind of narrow, they find it difficult to pass through. At times, there could be obstruction, which result to pains that the sickle cell carrier suffers from. So, if someone is AS, the person can only marry, because of the trait, the person can only marry AA genotype. and their offspring will be AA and AS, which is better. Then if someone is AC, the person can only marry AA genotype. The person cannot marry AS, and the person cannot marry SS, and the person cannot marry also SC genotype. What happens when you go to different lab and get different results is just that when you go to two different lab and get two different results, this simply means that one is false result, one is correct. All you have to do is just that you have to go to another lab. When you get to this lab, don't tell them that you've done already. Just tell them you want to do genotype. When you do the genotype result, use it to confirm the ones you've done already. One must correspond to one of the ones you have already. This is how to, in a complicated case, this is how to dictate to know your genotype. Then the question that whether genotype, so many people have been asking. I once had a patient that said that she went to the lab and she was confirmed AS. When she now went to meet her pastor now prayed for her that her genotype now changed to AA. All these things are fallacy. Genotype doesn't change. It doesn't change. Science has only proven that is only one method that genotype can change, which is the BMT method. BMT simply means bone marrow transplant. We all know that the red blood cells they are being produced in the bone marrow. So the only way someone's genotype can change is through bone marrow transplant. That's the only way genotype can change. I hope in this little video I've been able to convince you, not to confuse you, and you're able to understand what genotype is all about. Please, if you are new to this page, kindly do well to share. Follow the page, please. Do well to follow the page. Share. Drop your comment in the comment section. If you have any question, just feel free to ask your home doctor. I will answer you. Okay? Share with your friends. You might be helping someone out there through this little content. Thank you. Stay blessed. See you in my next video.